In today's To Your Well-Being, we are talking about what you should know about colon cancer and the importance of early detection. Nurse Christine Brannock is the Oncology Outreach Manager with Cone Health. So she is going to be the one who is answering all of our questions. So let's first off just talk about this. What exactly is colon cancer?
So colon cancer basically is cancer of the large intestine. So the large intestine is our colon, and the last few inches of the colon is our rectum, and that's where rectal cancer
Okay, so
occurs.
two different kinds of cancers, colon cancer and rectal cancer. Who's at risk for colon cancer? Are there certain groups that are at higher risk?
Yes, so most colorectal cancers occur in individuals over 50, but we have seen a lot more colorectal cancers in individuals under 50. So they did decrease the screening rate now to 45. It was 50. Also, some other things that could put at increased risk, obviously a family history, like if your parents, your grandparents, siblings would put you at a higher risk. If you have a confirmed diagnosis or suspect of colorectal cancer syndrome, such as the Lynch syndrome. It is a genetic syndrome. There is genetic testing where you could, if you were at high risk for that, and it is actually done here at the Cone Health Cancer Center. Also, if you were to have a family history of adenomas, which are basically precancerous polyps, or if you had a personal history of those polyps. Obviously, if you had a personal history of colorectal cancer, if you've ever had a history of radiation treatment to the abdomen or pelvic area to treat a prior cancer, if you've had any inflammatory intestinal conditions such as ulcerative colitis or Crohn's disease, those individuals, obesity, smoking, heavy alcohol abuse, sedentary lifestyle, low fiber, high fat diet, all those things would put you at an increased risk for colorectal cancer.
All right, so let's talk about what are some of the signs maybe that we should be looking for that could be a symptom of colon cancer and what should prompt us to kind of contact our healthcare provider. So first, let's go over the symptoms.
So some of the symptoms, the first one you might notice is a change in your bowel habits, such as if you're going more frequently, less frequently, more diarrhea, constipation, or if you're even seeing a change in the consistency of your stool, like if your stool maybe look like a pencil. They're very narrow because if there's a tumor in there, it could be blocking that colon and making it harder to get through, which is narrowing those stools out. It could also be any bleeding of your rectum or in your stool. Persistent abdominal discomfort. This could be cramping, gas, pain. If you have that sensation, your bowel just is not emptying. You just went to the bathroom and then you still feel the need to go. Weakness, fatigue, or if you had any unexplained weight loss, those would definitely all be symptoms that you would need to report to your provider and have checked.
Right, so if any of those pertain to you in any way, shape, or form, this is now when you should be taking action to call your doctor and at least get a checkup and see where you go from there. So for some people, these symptoms may be uncomfortable to talk about, or the person might associate it with other things like irritable bowel syndrome. So how important is it to not wait to get checked out for colon cancer?
It's very important because if we can find a colorectal cancer earlier, the greater chance of treatment and survival. There's so many treatment options. We've came so far that if we find them early enough, then like Julie said, patient may not need chemotherapy. If we were to find them when they're a pop before they even develop, as I'll talk here in a minute about the colonoscopy, you wouldn't have to do anything except to have that procedure done and remove that polyp.
Okay. All right. So then you go to the doctor and, you want to get tested. How is colon cancer diagnosed?
So the gold standard is that colonoscopy. And as I mentioned earlier, the recommended screening is to start at 45. Typically, it's every 10 years, though if you have one of those risk factors that I mentioned earlier and maybe more frequent, like 3 or 5 years, it's very important to talk to your provider about that. Then there's also other tests that can be done. They can do what they call a virtual colonoscopy. It's basically like where they do a CT screening. Though typically if they saw something, they would need to do a colonoscopy to actually diagnose. They can also do a sigmoidoscopy. Those are usually, if they're done, they're every 5 years. The only disadvantage to those is that it doesn't check the whole colon. It's only part of it. There is some at-home testing, like the FIT test, which is the fecal immunochemical test, where it's basically a stool sample that's sent to the lab. It's a one-time sample that's sent, and it can detect hidden blood in your stool. There's also some people may remember the old way that's not used as common, but it's still done. It's what they call a fecal occult blood test. It's like the stool cards that we used to give out, and some providers do still do those. It's usually a sample 3 days in a row, typically, or 3 stools in a row. You would do a sample from each of those, and that again detects hidden blood in the stool. The only disadvantage to that screening is you do need to follow a specific diet, and sometimes some of your medications may need to be adjusted, or you need to talk to your provider about during that period of time. Also, there is what they call a color guard. Some people probably heard of that, and that is a DNA test of the stool. That is done every 3 years. And again, any of those tests, if they came back showing anything, you would still need a colonoscopy ultimately.
So just how concerning is it that people have put off colonoscopies because of COVID and things like that?
It is very concerning because, as I mentioned earlier, that if we find a colorectal cancer later, it does decrease the options for treatment and can decrease the chance of survival. So it's very important not to let COVID delay you getting your screenings.
All right. So what age, let's talk about this. What age should we start getting our colonoscopy, and then how often do you get them?
So we recommended age 45. Now, if you have some of those risk factors that we mentioned earlier, then obviously it would be sooner. A lot of times we look at too, if you've had a family history, usually around 10 years prior to that youngest family member being diagnosed. And again, if you have any of those then you would need to talk to your provider about the best time for you.
All right, let's talk about the procedure itself, because I think when people hear colonoscopy, they're like, oh my goodness, what is that? So let's kind of talk about what someone should expect with a colonoscopy, and what will that procedure day kind of be like?
So it all starts, usually your doctor's going to give you what they call a bowel prep regimen. So a few days before, they're going to usually recommend you eat more of a low fiber diet during that time. Then usually around the day before, they'll tell you to start drinking, basically eating clear liquids, which would be kinds of foods like broth, maybe Jello or popsicles. But if you do eat Jello and popsicles, not the red ones. And then usually the night before, or depending on what time of the day it is, they'll tell you a certain period of time that you'll need to have nothing to eat or drink before that procedure. You will start drinking with that bowel prep regimen usually around the day before to make sure your bowel is clean. And the more clean that your bowel is, the easier it will be for the doctor to see your colon. And if they were to find any polyps, then they will be able to remove those. Usually the colon cancer does typically start as a polyp, so if we can get them out before they become cancer, then again, usually that's all that needs to be done, and we just watch that.
All right, so this is an outpatient procedure, so you're
Yes.
going to do the preparation beforehand, you go in that day, and then you're home that night.
Yes, usually you go home right after the procedure, and usually pretty much after the procedure, you can pretty much eat and drink as you feel comfortable. Sometimes you may feel a little gassy afterwards, but usually you don't remember anything. They're going to give you a medication, and if you are awake, you won't remember anything about it.
Right, you need someone to drop you off, and you need someone to pick you up and take you home. That is for sure. All right.
Yes, you do.
Any recommendations to help calm our nerves before we do this kind of procedure?
Basically, my biggest recommendation is follow the diet instructions your doctor gives you. So as they tell you to go to clear liquids, when they tell you not to eat anything or eat or drink anything, make sure you follow those recommendations, and it will make it a much smoother process.
Okay, and you said no red Jello or red things to drink, that kind of thing.
Yes, correct.
That red dye is not good in your system when it comes to this stuff. All right, so what steps can people take to reduce their risk for colon cancer?
The biggest thing is to eat a healthy diet, which is low in fat and high in fiber. Stop smoking, limit your alcohol intake, obviously exercise. Screenings are so important because if we can get polyps out before they turn into anything. Also, know your family history. If you have a family history, talking to your provider about the best times to get screened. As I mentioned earlier, there is genetic testing if you are somebody that has that strong family history.
Mm-hmm. And this is one of those times, because some people have been keeping it off, right, for COVID and stuff like that. But sometimes now when you call the doctor's office, they're scheduled months and months out. So we don't want people to wait to make the call.
Well, and it's important to know what's normal for you. So if you notice any changes, make sure you report that. and let your provider know, because that way they can get you in when you need to be screened.
Great. Thank you so much for your time and your expertise. We so appreciate that. If you missed any of this, you can find the information on our website. That's WFMYnews2.com.